hear the beat.
Assalamu alaikum, dear all students, my dear friends. This is Mir Asif, and you're watching me on YouTube channel A&H Study Hub. So, we'll be discussing about the cardiac arrhythmias. So, today's lecture will be just a brief lecture on cardiac arrhythmias. So, first of all, we all should know what is normal rhythm. Means how many times heart beats per minute. So the normal average is around 72 beats per minute, but the normal range average is around 72 beats per minute, but the normal range is around 60 beats per minute to 100 beats per minute. So, if the heart beats in between 60 to 100 beats per minute, so that means our heart is in normal rhythm. But the cardiac arrhythmia means when the heart deviates from the normal rhythm. Means if suppose it goes beyond to the 100 or it goes less to the 60 beats per minute. So that is called cardiac arrhythmia. So, on the basis of heart rate, on the basis of heart rate, cardiac arrhythmias are characterized into two. Cardiac arrhythmias are characterized into two. One is tachyarrhythmias, and the second one is bradyarrhythmias. Okay, so this is also called tachyarrhythmias. You can call also tachycardia, tachyarrhythmia or tachycardia, or bradyarrhythmias, or you call it simply bradycardia. Means when tachycardia means when the heart goes beyond 100, when the heart rate is around, when the heart rate is more than 100 beats per minute. But the bradyarrhythmias, when the heart rate is less than 60 beats per minute. So that condition is called a cardiac arrhythmia. So tachyarrhythmias are further classified into different groups. One is simple tachycardia. Simple tachycardia. And the second group is paroxysmal tachycardia. And the third one is flutter. And the fourth one is fibrillation. So that means on the basis tachyarrhythmias are classified into four groups. How many groups? Four groups. First one is simple tachycardia. So simple tachycardia is when the heart rate is about 100 to 150 beats per minute. When the heart rate is in between 100 to 150 beats per minute. Then the second condition is paroxysmal tachyarrhythmias or paroxysmal tachycardia. Paroxysmal tachycardia is when the heart rate is in between 150 to 250 beats per minute. 150 to 250 beats per minute. And this third condition is flutter. When heart rate goes beyond 250, that means in between 250 to 350 beats per minute. But for unfortunate patients who are having the fibrillation, those unfortunate patients, their heart rate goes more than 350 beats per minute. 350 beats per minute. I hope all of you understood the tachyarrhythmias and its types. Okay, so I will wrap it now. So secondly, we'll discuss about the bradyarrhythmias. So this was all about tachyarrhythmias, and the second condition is bradycardia or bradyarrhythmias. Bradycardia is also classified into three groups. Bradyarrhythmias are also further classified into three groups. First one is mild bradycardia. Mild bradycardia or bradyarrhythmia. And the second condition is moderate bradycardia or bradyarrhythmia. And the third condition is severe bradycardia or bradyarrhythmia. So what are all these types? Simple bradycardia means when the patient's heart rate goes less than 60 beats per minute. That means in between 60 to 40 beats per minute. When the patient's heart rate is around in between 60 to 40 beats per minute, so that we'll call as mild bradycardia. But in second condition, moderate bradycardia. So in this condition, when the patient's heart rate goes less than 40 beats per minute, means up to 20, we call it moderate bradycardia. So 40 to 20 beats per minute. When the heart rate reduces less than 40 up to the 20 beats per minute, so that will call as moderate bradycardia. And the third condition is severe. So for all these unfortunate patients or in severe bradycardia, patient's heart rate goes more or less, means which is less than 20 beats per minute. So patient's heart rate goes less than 20 beats per minute. So we were discussing about the arrhythmias, cardiac. This was all about on the basis of heart rate. So now we'll discuss about on the basis of cardiac arrhythmias on the basis of site. Suppose if the cardiac arrhythmias are happening in the atrias, wherever, in the atrias means above the ventricles. So those arrhythmias are called atrial arrhythmias. Arrhythmias. And the second condition, those are called atrial arrhythmias. If suppose the arrhythmias are happening in the ventricles, so those arrhythmias are called ventricular arrhythmias. Those conditions are called ventricular arrhythmias. But if suppose the arrhythmias are happening in our AV node, if the arrhythmias are happening in the AV node, so those conditions are called junctional arrhythmias. Junctional arrhythmias. And if suppose the arrhythmias are happening in the SA node, so those arrhythmias are called sinus arrhythmia. Sinus arrhythmias. Okay,